Hi everyone. Today's question is, how does chronic kidney disease affect vitamin A metabolism? What does this mean for patients with CKD? If you find today's content useful, please share it with your friends. Vitamin A is an essential nutrient that plays a crucial role in vision, immune function, cell growth, and many other important processes. In a healthy person, the liver releases most of the stored vitamin A into the bloodstream, where it circulates in the blood, primarily bound to a carrier protein called RBP4 first. Because of the reduced clearance of vitamin A by the kidneys, both retinol and RBP4 levels in the blood can double. It's important to pay attention to both diet and supplementation. When it comes to dietary sources of vitamin A, you should avoid liver and fish oils, which are high not only in vitamin A, but also in potassium and phosphorus, which can be problematic for patients with CKD. Cooking vegetables by boiling rather than steaming or microwaving them can reduce carotenoids by 20 to 30%. Carotenoids are converted to vitamin A in the body, so this is another way to indirectly reduce vitamin A levels. In multivariable analysis, each 1 micromole per liter increase in retinol was associated with a 15% higher risk of dying. The maximum recommended intake for adults with CKD is between 700 and 900 micrograms per day. Vitra itself has shown some therapeutic promise in animal models of kidney disease, where it was found to reduce fibrosis and inflammation. However, results from human trials have been mixed, and this is likely due to several factors, including the need for safer dosing of retinoids, as well as the lack of pediatric guidelines for the use of ATRA in children with CKD, which is less than the dry or dietary reference. Intake of 900 to 1100 micrograms per day for women and 700 to 900 micrograms per day for men. For pediatric patients with CKD, 53% of those studied were found to exceed the recommended intake of vitamin A. Moreover, high vitamin A levels stimulate osteoclasts, leading to hypercalcemia or high calcium in the blood. In dialysis patients, RBP4 levels can predict the severity of hypercalcemia, explaining 32% of the variance. In chronic kidney disease, the accumulation of vitamin A, particularly in the form of retinol, is associated with increased mortality and other complications such as bone disease and cardiovascular risks. Although ATRA, the active form of vitamin A, may hold therapeutic potential, as discussed in a previous video, careful monitoring of vitamin A levels is crucial, especially in dialysis patients who are at the highest risk for complications. Routine vitamin A supplementation should be avoided unless there's a clear deficiency, and dietary management should aim to balance the need for adequate nutrition with the restrictions imposed by CKD. Future research should focus on developing personalized approaches to vitamin A management, taking into account the various factors that influence its metabolism and the diverse needs of patient populations, especially children and those on dialysis. Finally, elevated RBP4 has been linked to atherosclerosis and insulin resistance, which are risk factors for cardiovascular disease. Ironically, ATRA, the active form of vitamin A, may have a protective effect against cardiovascular disease. So the picture is quite paradoxical. On the one hand, we have reduced clearance and increased survival, death, and on the other hand, we have the potential for ATRA to exert its beneficial effects. Second, the conversion of retinol to its active form, all trans-retinoic acid or ATRA, is also impaired. As a result, there's a buildup of retinol in the blood, and this happens early in the course of chronic kidney disease. In fact, retinol levels rise by 13% for every 10 milliliter per minute decline in eGFR. This is important because high levels of vitamin A in the blood, especially in the form of retinol, are associated with worse outcomes, which stands for retinol binding protein 4. Around 50% of the circulating retinol comes from the kidneys, where it's filtered by the glomeruli and reabsorbed almost completely via megalin receptors. Megalin then delivers the vitamin A back into the circulation. This tightly regulated process ensures that vitamin A levels are kept within the healthy range. But when kidneys are damaged, as in chronic kidney disease, this delicate balance gets disrupted. In a study called NHANES, which included 689 patients with CKD, higher levels of retinol were found in non-survivors compared to survivors. To keep vitamin A levels under control, Supplementation with vitamin A is generally not recommended unless there's a clear deficiency. Finally, in conclusion, thank you for watching. See you next time.